is Akram Jafar, and today I'm going to talk about the infratemporal fossa. The fossa is called infratemporal fossa because it is located below the temporal region where a temporal fossa is located. This temporal fossa is bounded by the superior temporal line and the inferior temporal lines. Inferiorly, the boundary of this temporal fossa is the infratemporal crest. So the infratemporal crest, in fact, separates between the temporal fossa and the infratemporal fossa. The infratemporal fossa, which we are concerned with today, is located here. Now, in the floor of the temporal fossa, we have parts of four bones. These are the frontal bone, the parietal bone, the temporal bone, and the sphenoid bone. In fact, it is the greater wing of the sphenoid. Remember that these four bones, they participate in the formation of the region of the pterion. In the temporal fossa, the fossa is covered by the temporal fascia, a very strong fascia, which also provides attachment for the underlying muscle, in fact. And also in the temporal fossa, I'm talking about these details because we're going to have the origin of these structures in the infratemporal fossa. So in the temporal fossa, we have the superficial temporal vessels. This is a terminal branch of the external carotid artery together with the maxillary artery, which is the artery of the infratemporal fossa. And also we have the auriculotemporal nerve, which is a branch of the mandibular division of the trigeminal nerve, which is located in the infratemporal fossa. And deep to the muscle, which is located in the temporal fossa, there are the deep temporal vessels, as well as nerves. The nerves supply the muscle, the temporalis, and the arteries, as I said, they are located deep to the muscle, the deep temporal arteries, which are branches of the maxillary artery, which is the artery of the infratemporal fossa. Also, today we are going to deal with the muscles of mastication, and these are four muscles: the temporalis, the masseter, medial pterygoid, and the lateral pterygoid. And they are all attached to the mandible, and so they move the mandible, and they are all supplied by the mandibular division of the trigeminal nerve, which is the only division of the trigeminal nerve that has motor fibers. The first muscle is temporalis, and temporalis actually occupies the temporal fossa and is covered by the temporal fascia. It's a fan-shaped or triangular muscle, and it is inserted into the coronoid process of the mandible. The muscle has fibers in different orientation. The anterior fibers and the middle fibers, they elevate the mandible, while the posterior fibers, which are almost horizontal, they retract the mandible, and if the muscle acts unilaterally, it results in ipsilateral excursion of the mandible. The second muscle of mastication is masseter, and this is a quadrate muscle. You can see it here. This muscle is quadrate muscle. On one side, it is attached to the zygomatic arch, and then it is attached to the mandible as any other muscle of mastication. Which part of the mandible? The lateral surface of the ramus of the mandible and the angle of the mandible. If we look closely at the muscle, we will find that it has, most of the muscle is the superficial head of the muscle, but in addition to that, it has a small deep head here. And so the muscle acts in elevating the mandible, protruding the mandible. Look at the direction of most of the fibers of the muscle of the superficial head, so they move the mandible forward. But the deep head of the muscle can retract the mandible. So this is another muscle that can retract the mandible, but the main retractor of the mandible are the posterior fibers of temporalis. And if the muscle acts unilaterally, it causes ipsilateral excursion. Now let's move to the infratemporal fossa, and to start with, let's define the infratemporal region. It is the space that lies beneath the base of the skull It is located between the side wall of the pharynx. In fact, if we add the muscles here, we will have the superior constrictor muscle of the pharynx located at this level. And so it lies between the side wall of the pharynx and the ramus of the mandible. This part of the mandible has been removed so that we can access the infratemporal region. The boundaries: anteriorly, it is the maxilla, posterior surface of the maxilla, and superior to that is the inferior orbital fissure, which is located between the maxilla and the greater wing of the sphenoid. The medial boundary is the lateral pterygoid plate as it approaches the posterior part of the maxilla and leaves between it and the maxilla a fissure which is called the pterygomaxillary fissure between the lateral pterygoid plate and the maxilla. Posteriorly, it is the styloid process, which is part of the temporal bone, and the muscles that are attached to the styloid process and the ligaments, and collectively they are called the styloid apparatus. And then laterally, the structure that has been removed from here, and this is the ramus of the mandible. The roof of the fossa is the inferior surface of the greater wing of the sphenoid, this area. And in addition to that, part of the squamous part of the temporal bone, which is located in the front of the articular eminence. Look at the greater wing of the sphenoid again, and you will find that in the roof of the fossa, there are two foramina that communicate with the middle cranial fossa, the oval one, that is the foramen ovale, through which the mandibular division of the trigeminal nerve passes, and then lateral to it is the foramen spinosum, which is close to the spine of the sphenoid, and through which the middle meningeal artery passes through. Now, returning back to the other two muscles of mastication, which are in fact located in the infratemporal fossa, we'll start with the lateral pterygoid muscle, and this muscle has two heads. The inferior head of the muscle is attached to lateral surface of the lateral pterygoid plate, that's the inferior head, while the superior head of the muscle is attached to the greater wing of the sphenoid, to the infratemporal surface of the greater wing of the sphenoid, this infratemporal surface of the greater wing of the sphenoid. So two heads, a superior head and an inferior head, and the two heads, as you can see, they pass posteriorly and laterally, and they are inserted here to the mandible. First of all, some of the fibers are attached here to the neck of the mandible. There's a small depression here at the neck of the mandible, but not only at the neck of the mandible, it is also attached, as you can see here, to the capsule of the temporomandibular joint, and in fact some of the fibers pass into the joint and are attached to the intra-articular disc, and they can pull forward on the intra-articular disc. This is the direction of pull of the muscle. They pull forward on the neck of the mandible and the intra-articular disc, and so they draw the condyle and the intra-articular disc forward from the glenoid fossa. And as we have just mentioned here, that in front of the glenoid fossa there is an articular eminence. So the head of the mandible is drawn down the slope of the articular eminence, and this results in depression of the mandible, and this helps in active opening of the mouth. So it is an active opener of the mouth. The mouth can be actively and passively opened. So passively opened by the gravity, but this is an active opening of the mouth. In addition to that, again, look at the direction of the pull of the muscle. They result in protrusion of the mandible, and unilaterally result in contralateral excursion of the mandible. Now, the second muscle in the infratemporal fossa is the medial pterygoid muscle. This is the medial pterygoid muscle, and again it has two heads, but these are the deep head. Most of the muscle is the deep head, and the deep head is attached again to the lateral pterygoid plate, but to the medial side of the lateral pterygoid plate. So this lateral pterygoid plate, from the lateral side, it provides attachment to the inferior head of the lateral pterygoid muscle, and from the medial side, it provides the attachment of the deep head of the medial pterygoid muscle. The deep head of the medial pterygoid is joined by the superficial head. This is the superficial head. It is a small part of the muscle, and it's attached to the tuberosity of the maxilla. This region, the tuberosity of the maxilla, part of the bone that is located behind the third upper molar tooth. The muscle, as you can see, the superficial and deep heads, they unite together and they are attached to the mandible. Actually, they are attached to the inside of the angle of the mandible, and this is exactly opposite to where the masseter muscle is attached on the outer surface of the mandible. So the angle of the mandible is in fact sandwiched between the masseter muscle externally and the medial pterygoid muscle internally. You can see here that there's a rough area here because of the attachment of the medial pterygoid muscle. The muscle therefore causes elevation of the mandible. Also, it causes protrusion of the mandible, as well as contralateral excursion of the mandible. And so if the muscles, they act alternately, the two muscles on either side, they act alternately, they will cause side-to-side movement as in chewing. So far about the two muscles in the infratemporal fossa. Now let's deal with the main nerve of the infratemporal fossa, and this is the mandibular nerve. The mandibular nerve is V3. It is the third division of the trigeminal nerve, and it has a sensory root that arises. This is the biggest one. It arises from the ganglion, from the trigeminal ganglion, which is located in the middle cranial fossa. And then it has also a motor root, because this is the only division of the trigeminal nerve that carries motor fibers. The other two divisions, V1, the ophthalmic division, and V2, the maxillary division, they are purely sensory, but the mandibular nerve has a sensory root, which is the bigger root, and a motor root that unite together as they pass through the foramen ovale. The foramen ovale is the foramen that communicates between the middle cranial fossa, where the trigeminal ganglion is located, and the infratemporal fossa, where the nerve passes. In the infratemporal fossa, this nerve, the mandibular nerve, is located on the surface of a muscle, which is called tensor villi palatini muscle. This should be the location of the tensor villi palatini muscle. So the mandibular nerve is located on the surface of tensor villi palatini muscle, deep to the lateral pterygoid muscle. Here is the lateral pterygoid muscle. It has been cut here in this diagram. There is a ganglion which is called the otic ganglion, one of the four parasympathetic ganglia in the head. And the otic ganglion is applied to the deep surface of the nerve. I cannot show it to you in this diagram, but I will show it to you in another diagram, the otic ganglion. Now this nerve, this mandibular nerve, the main trunk of the mandibular nerve will soon divide into anterior and posterior divisions, but the main trunk of the nerve itself has two branches. It has one sensory and one motor branch. The sensory branch is called the meningeal branch, or the nervus spinosus, and this re-enters the middle cranial fossa, usually through foramen spinosum, where the middle meningeal artery is located as well, to supply the meninges of the middle cranial fossa. It is sensory, and also it supplies the mastoid air cells. And then we have the motor branch, and this is the nerve to medial pterygoid muscle. So the nerve to medial pterygoid arises from the main trunk of the mandibular nerve, and you should keep in mind that this nerve to medial pterygoid not only supplies the medial pterygoid muscle, but also supplies two other small muscles that carry the name tensor. So tensor villi palatini muscle, a muscle of the palate, and a tensor tympani, which is located in the middle ear. So the motor root of the mandibular nerve, not only supplies the muscles of mastication, but also supplies some other muscles, including two tensor muscles that are supplied by the nerve to medial pterygoid. Then it divides, the trunk divides into anterior and posterior divisions. Let's deal with the anterior division of the mandibular nerve. This is the mainly motor division, but has one sensory root. So the motor fibers are going to supply the other muscles of mastication. So there is a nerve to supply the lateral pterygoid muscle, nerve to lateral pterygoid, and there is another branch that supplies the masseter muscle, and this nerve passes above the lateral pterygoid muscle. This is the lateral pterygoid muscle, the two heads of lateral pterygoid. So there is the masseteric nerve passes above the lateral pterygoid to reach the masseter muscle. Here the masseter muscle has been reflected. You can see the zygomatic arch where the muscle, the masseter muscle is attached, is cut in here, and the muscle is reflected downwards, and you can see the nerve supplying the muscle coming from the infratemporal fossa through the mandibular notch and reaches the muscle and supply it. It also supplies an articular branch to the temporomandibular joint. So nerve to lateral pterygoid, nerve to masseter, and then we have the deep temporal nerves. These nerves that we mentioned before that are located in the temporal fossa, and they supply the overlying temporalis muscle. So these are three motor branches for the remaining three muscles of mastication, because the medial pterygoid is supplied from the main trunk. The one sensory branch is called the buccal nerve, or the long buccal nerve, to differentiate it from the buccal branch of the facial nerve that supplies the muscles of facial expression. It's motor to the muscles of facial expression. This long buccal nerve is sensory, and it is a branch of the anterior division of the mandibular nerve. It is characterized by the fact that it arises between the two heads of the lateral pterygoid muscle. It reaches the buccinator. It supplies the skin over the buccinator, the skin of the cheek, and some of the fibers, they pass through the muscle, through the buccinator. You can see here the duct of the mandibular gland also passes through buccinator. Now the branches from the long buccal nerve, they pass through the buccinator muscle to supply the mucous membrane of the cheek and the gum of the lower jaw, opposite the lower molars and the second premolar, down to the level of the mental foramen. So this nerve not only supplies the skin of the cheek, but also the lining mucous membrane and the part of the gum of the lower jaw. So far about the branches of the anterior division of the mandibular nerve. Now the posterior division of the mandibular nerve is mainly sensory. The anterior is mainly motor, the posterior is mainly sensory, the anterior is mainly motor, but there is one sensory branch. The posterior is mainly sensory, but there is one motor branch. Now let me orient you about this diagram. This is a diagram showing the infratemporal fossa as if we are looking at it from medial to lateral, not from lateral to medial, from medial to lateral. So it shows the inside of the mandible. That's why we can see this structure, which is located medial to the mandibular nerve. This is the otic ganglion, which is the parasympathetic ganglion, another structure that is located in the infratemporal fossa. And you can see the branches of the posterior division, the sensory ones. It is mainly sensory. But this is the lingual nerve, and then the inferior alveolar nerve, and this is the auriculotemporal nerve. The inferior alveolar nerve, before it passes through the mandibular foramen, it gives a small tiny branch. This branch carries motor fibers to the anterior belly of digastric and to the mylohyoid muscle. And this is the one branch of the posterior division that carries motor fibers. Now let's go into some more details of the branches of the posterior division and start with the auriculotemporal nerve. It passes backwards and laterally. There are two roots, and these two roots, as they are passing backwards and laterally, they are going to face the middle meningeal artery, a branch of the maxillary artery, and so one of the roots pass superficial and the other pass deep to the middle meningeal artery, and then they unite and pass medial to the neck of the mandible. The nerve is sensory to the external acoustic meatus and to the auricle, and also to part of the temple. It also carries the sensory fibers for the parotid gland, and it has an articular branch of the temporomandibular joint. But in addition to that, it carries secretomotor fibers. These are postganglionic fibers that are derived from the otic ganglion. So these secretomotor postganglionic fibers are carried by the auriculotemporal nerve to the parotid gland. The second sensory branch of the posterior division of the mandibular nerve is the lingual nerve. This is the lingual nerve. It emerges from under cover of the lateral pterygoid muscle. You can see it here where the lateral pterygoid is shown. You can see that the nerve arises from under cover of the lateral pterygoid muscle and is located anterior to the inferior alveolar nerve. That's how you can identify the nerve. And it comes into direct contact with the medial pterygoid. This is the medial pterygoid, so it passes superficial to the medial pterygoid. Then it also is related to a shallow groove which is located in the mandible just below the third molar, mandibular molar tooth, and then it passes anteriorly under cover of the oral mucosa. Now the nerve itself, the fibers that originate from the trigeminal nerve, they supply all the lingual gum and the mucous membrane of the floor of the mouth, general sensory fibers. It supplies ordinary sensation for the anterior two-thirds of the tongue, pain, touch, temperature sensation. That's what we call ordinary somatic sensation. But these are not the only fibers that are carried by the lingual nerve. The lingual nerve carry some fibers that are that join the nerve from the chorda tympani. I'm going to talk about it in a moment. And also it is connected here, as you can see, to another ganglion, parasympathetic ganglion, which is the submandibular ganglion. So let's deal with the chorda tympani, and this is a branch from the facial nerve. Look at this diagram here. The facial nerve, before it leaves the stylomastoid foramen, it is located in the petrous part of the temporal bone, and it provides this branch that passes through the middle ear and is related to the tympanic membrane, hence is called the chorda tympani, and then it leaves the middle ear through the petrotympanic fissure, which is located in the roof of the infratemporal fossa, and then it joins the lingual nerve. This chorda tympani, in fact, carries two types of fibers. It conveys taste sensation from the anterior two-thirds of the tongue, and it contains parasympathetic secretomotor fibers that will later on relay in the submandibular ganglion, and the postganglionic fibers are distributed to the submandibular and the sublingual salivary glands. So all in all, the lingual nerve contains multiple types of fibers. It carries the fibers of the general sensations and carries taste fibers that are going later on to pass through the chorda tympani, and also the chorda tympani carries fibers that are secretomotor parasympathetic fibers that are going to relay in the submandibular ganglion. The other sensory branch of the posterior division is the inferior alveolar nerve, and again it emerges from under cover of the lateral pterygoid muscle, located a little bit posterior to the lingual nerve, and then on the surface of the medial pterygoid muscle, between the muscle and the ramus of the mandible, where it enters the mandibular foramen. At this location, it is accompanied by a branch of the maxillary artery, inferior alveolar artery, and inferior alveolar vein. So inferior alveolar vessels in general, and in the mandibular canal, it is in close proximity to the roots of the third molar. That's why it might be injured during removal of an impacted third molar. You can see here in this X-ray, the roots of the third molar is very close to the mandibular canal. Look at the mandibular canal. It's a little bit radiolucent, and here the roots of the third molar is in fact within the mandibular canal. Before it enters the mandibular foramen, it gives this small branch, the nerve to mylohyoid, because it supplies the mylohyoid, but not only the mylohyoid, but the anterior belly of digastric. You can see here that it makes a groove on the bone, in fact, here, and this nerve passes below the muscle, below the mylohyoid muscle. Look at the mylohyoid line here. This is the mylohyoid line where the mylohyoid muscle is attached, and the nerve passes below the mylohyoid, so it appears in the submandibular and submental triangles, while above the mylohyoid, the lingual nerve passes, so it is present in the mouth, because the mylohyoid is in fact like a diaphragm which separates between a mouth above and the neck below. This nerve to mylohyoid, supplies the mylohyoid and anterior belly of the digastric muscle. Remember that the mandibular nerve is the only division of the trigeminal nerve that carries motor fibers, and it supplies the four muscles of mastication, but it also supplies four other muscles. Two of them are the tensor muscles, tensor villi palatini and the tensor tympani, that are supplied with motor fibers via the branch to medial pterygoid from the main trunk of the nerve, and the other two are the mylohyoid and the anterior belly of the digastric muscle. Remember that also the digastric muscle, which has two bellies, the anterior belly is supplied by the mandibular nerve, but the posterior belly of the digastric is supplied by the facial nerve, together with the accompanying muscle, the stylohyoid muscle. Now, as the inferior alveolar nerve passes through the mandibular canal, it supplies the three molar teeth, the two premolar teeth, and then as it reaches the region of the mental foramen, it divides into an incisive nerve, not shown here, which supplies the canine and both incisors, and rarely it overlaps into the central incisor of the other side. So this is the incisive nerve. And then we have the mental nerve that passes through the mental foramen together with the mental vessels, and the mental nerve not only supplies the skin over the lower lip and the chin, but also supplies the mucous membrane of the lower lip, and in addition to that, it supplies the vestibular gingiva of the mandibular incisors. Remember that the vestibular gingiva posterior to that is supplied by the long buccal nerve. The inferior alveolar nerve can be blocked by injecting anesthetic fluid around the mouth of the mandibular canal at the mandibular foramen, and in this case, the teeth that are going to be affected are all the mandibular teeth. The other tissues that are affected are the skin and mucous membrane of the lower lip, mental nerve, vestibular gingiva of the mandibular incisors. So all these are supplied by the mental nerve, and since we are going to block the nerve here, then the mental nerve is going to be blocked as well. One of the complications here is vascular penetration. As the needle is passed, the inferior alveolar nerve is not the only structure that passes through the mandibular foramen. There are the inferior alveolar vessels, so vascular penetration might take place. And if the needle is directed too far posteriorly, then the needle might infiltrate the parotid gland, the deep part of the parotid gland, which is located here behind the ramus of the mandible. And remember that within the parotid gland, the facial nerve divides, unites, redivides to form the 5 motor branches that arise from the parotid gland. So this might result in anesthesia of the branches of the facial nerve within the gland, resulting in facial paralysis. And fortunately, this is a temporary facial paralysis, as you can see in this video. So the patient is unable to blink because the orbicularis oculi is not functioning, as well as all the muscles on that side of the face, they are not functioning, and this will result in drawing of the mouth to the non-affected side as she is smiling. Now let's deal with another content of the infratemporal fossa, and this is the maxillary artery. As we have mentioned, that the maxillary artery is a terminal branch of the external carotid artery. The other terminal branch is the superficial temporal artery, which is located in the temporal fossa. And then we have the maxillary artery. The maxillary artery passes forwards and medially between the neck of the mandible and the sphenomandibular ligament. This is a ligament that you can find in the infratemporal fossa. It is an accessory ligament of the temporomandibular joint. It's called the sphenomandibular ligament because it extends between the spine of the sphenoid bone. Remember, the sphenoid bone is located in the roof of the infratemporal fossa. Foramen spinosum is so close to the spine of the sphenoid. And so the ligament, the sphenomandibular ligament, extends between the spine of the sphenoid and the mandible at very close to the lingula, which is located at the opening of the mandibular canal, at the mandibular foramen. The artery is accompanied by the auriculotemporal nerve and the maxillary vein. It may be superficial to the lateral pterygoid, as in this case, or sometimes it may be deep to the lateral pterygoid. And as you can see, that the maxillary artery disappears in the medial wall of the infratemporal fossa, where there is the pterygomaxillary fissure. So it enters into the pterygomaxillary fissure, and this is where the third part of the maxillary artery is located. It goes into the pterygopalatine fossa and gives branches. So for descriptive purposes, the maxillary artery is divided into three parts in relation to the lateral pterygoid muscle, whether the artery is deep or superficial to the muscle. But the first part of the artery is proximal to the muscle. The second part of the artery is either superficial or deep to the muscle. And the third part of the artery is not shown here because it goes through the pterygomaxillary fissure in the pterygopalatine fossa. There are almost 5 branches from each part. So the first part of the maxillary artery, which is located lateral to the lateral pterygoid muscle, has 5 branches. All these branches, they pass through foramina. We have the inferior alveolar artery that passes through the mandibular foramen. We have the important middle meningeal artery that passes upwards through the foramen spinosum. Sometimes there is another accessory meningeal artery which passes through foramen ovale, usually accompanying the mandibular nerve. And there are 2 small branches, not very clearly shown here. These are the 2 small branches in this diagram for the ear. We have the deep auricular and the anterior tympanic. They are located on either side of the tympanic membrane. So the deep auricular supplies the external acoustic meatus, superficial to the tympanic membrane, and the anterior tympanic artery passes through the petrotympanic fissure together with the chorda tympani and is located in the middle ear, medial to the tympanic membrane. So 5 branches all in all. The second part of the maxillary artery has 5 branches, but they are muscular branches. They do not pass through foramina. So we have the deep temporal arteries that we mentioned before. They are located deep to the temporalis muscle. And we have a branch to medial pterygoid. We have another branch to lateral pterygoid muscle, branch to masseter. So the 4 muscles of mastication, and in addition to a branch that accompanies the long buccal nerve. Remember the long buccal nerve that supplies the skin of the cheek and passes through the buccinator muscle. So it accompanies the long buccal nerve. These 5 branches, they supply muscles and they do not pass through foramen. They are muscular branches. The third part of the maxillary artery, which is not shown in this diagram, it is located in the pterygopalatine fossa. Again, it has 5 branches, and all these branches, they accompany the branches of the maxillary nerve, not the mandibular nerve. The maxillary nerve is the nerve of the pterygopalatine fossa. The mandibular nerve is the nerve of the infratemporal fossa. So the branches of the maxillary artery are going to be distributed with the branches of the maxillary nerve in the pterygopalatine fossa. These are the branches of the third part of the maxillary artery, and they include the posterior superior alveolar, the descending palatine, the artery of the pterygoid canal, the sphenopalatine artery, and the infraorbital artery. I'm not going to go into details of these arteries because these are dealt with the pterygopalatine fossa. The other component of the infratemporal fossa are the veins, and the vein is the maxillary vein, but the maxillary vein is formed from a plexus of veins, which is called the pterygoid venous plexus. We cannot see it in this diagram because it is located deep to the masseter, deep to the ramus of the mandible. They should have been removed, but we expect that it is located in and around the lateral pterygoid muscle, one of the 2 muscles that are located in the infratemporal fossa, and they will give rise to the maxillary vein that drains into the retromandibular vein. This is the retromandibular vein located behind the mandible. So here's the maxillary vein that accompanies part of the maxillary artery and is located deep to the neck of the mandible. It drains this pterygoid venous plexus. This plexus has important communications. So it communicates with the cavernous sinus, which is located inside the middle cranial fossa on either side of the pituitary fossa, and this communication is through foramen ovale, because foramen ovale communicates between the infratemporal fossa and the middle cranial fossa, and also it communicates with the inferior ophthalmic veins. These inferior ophthalmic veins, they partly communicate with the cavernous sinus and partly they pass through the inferior orbital fissure, and so they reach the infratemporal fossa. And also they communicate with a vein which is called deep facial vein, which arises from the facial vein on the face. These communications could provide another route of the spread of infection from the dangerous triangle of the face. That infection could pass through the ophthalmic veins directly to the cavernous sinus, or it could pass indirectly through the deep facial or the inferior ophthalmic vein to the pterygoid venous plexus, and then it communicates with the cavernous sinus. This pterygoid venous plexus, with its communication, actually it might act as a peripheral heart, aiding in the venous return from the incompressible parts, from the orbit, from the face, because as we said that the plexus is located in and around the lateral pterygoid muscle. So when the lateral pterygoid muscle contracts as the mandible moves, like for example, not only in chewing but in yawning as well, this results in a pumping action by the lateral pterygoid muscle on the pterygoid venous plexus. Thank you.